What's up, guys? This is Fuse Allegiant, and welcome to Virtual Knee Surgery. So, I've been playing this game ever since I was like 5 years old, and I'm pretty sure I know what to do, but I haven't played it in about 3
Welcome
years
to Virtual
now.
Knee Surgery.
Yeah, it's been a
This
while.
activity will show you the process of replacing a failing knee joint. Are you ready?
Are you
Today,
ready?
our patient is a 76-year-old man.
76-year-old man.
It is mandatory to check the patient's vital signs before beginning surgery. An anesthesiologist in the operating room performs this step. If the patient's vital signs are not in the normal ranges, we will not proceed with the surgery. Using the
Just when I
healthy
play
person's
these
vital
games, it
sign
makes me
chart as a
feel like an
reference,
actual doctor.
can our patient
So
undergo
cool.
surgery today? We will not proceed with the
What?
surgery.
Can the patient undergo the surgery? Either click yes or no.
It looks
Yeah.
like surgery will proceed
Looks
as
like
planned. Take a moment to
we
look
will
at our
proceed
patient's
as planned.
x-rays. Which knee do you think needs surgery? It looks like surgery will proceed as planned. Take a moment to look at
It
our...
looks
You're
like
right.
the
His
left
left knee
knee.
appears worn down and lacking
Yeah.
cartilage, which is likely the cause of his pain. The nurse has begun prepping our patient for
Looks kinda
surgery
like
by
it's just,
placing
like,
an IV
rubbing
needle in
together
his right
at
hand.
the
Now
bottom.
it's your turn. Use the
There is
marker
no
and
top
write
or
your
bottom,
initials
but
on the
just
proper knee to be
rubbing
operated on.
together.
This may seem
Marker.
silly, but it's an actual step taken
Just
to
draw
prevent
crap all
wrong site
over 'em.
surgeries. Use the marker and write your initials on the proper knee to be operated on. This may seem silly, but it's an actual step taken to prevent wrong site surgeries. The anesthesiologist administers drugs through the IV
It's like,
and through a mask over the
okay.
patient's face. What function should these drugs perform? Establish a sterile field around the surgical area. A series of sterile drapes isolates
Oh
the
yeah, this is
surgical
where you're
field from
supposed
the
to
rest
like
of the patient's
place
body.
the
A
patient's
tourniquet
leg.
is applied to cut off blood
A
flow, which allows a clearer view of the surgical field during surgery. To kill the bacteria
Oh,
on
this
the
is just
patient's leg,
weird. This
clean it
one's
in a
weird.
betadine solution.
Okay.
This scrubbing process will limit the chance of bacterial infection. To kill the bacteria on the patient's leg, clean it in a betadine solution.
Grab the sponge.
This scrubbing process will limit the chance of bacterial infection.
Click and drag the sponge into the bowl to soak it. Drag the soaked sponge over the leg and foot. Coat them in betadine. Blah.
Betadine scrub is applied 2 more times, followed by the final arrangement of sterile drapes.
That's freaky.
Why do you think knee surgery involves so
What
many
do you
drapes?
think the knee surgery involves so many drapes to keep the patient warm in the
Why do you
frigid
think knee surgery involves so many drapes?
or I'm just gonna click the longest one.
Good work. Use the sterile marker to draw the location for our incision. And don't
Grab
forget
the
to mark the
marker out of the
perpendicular lines too.
toolbar below.
Typically, the incision line is 6 to 7 inches long. The sterile marker to draw the location for our incision. And don't forget to mark the perpendicular lines too. Typically, the incision line is 6 to 7 inches long. Do you think the perpendicular lines serve?
What? Jeez, do I have like a freaking cold or something? I've coughed like 4 times.
Let's use the Bovie pencil to
Oh.
cauterize the veins. This will help
Oh,
decrease blood flow into the surgical
just makes me
field.
feel so weird. Ugh, the Bovie or the cauterizer. I had
The rake
no
retractors
problem
fold
with
the
this
skin
when I
and
was
tissue
little,
out of the
but
way,
this is just
exposing our patient's
disgusting.
knee. To operate, we need the patient's knee elevated
Oh,
and
yeah, and
bent
then
so the bones are fully exposed.
Mm,
Now the legs at the proper angle. Use the rongeur
the
to remove the anterior cruciate ligament, or ACL, the meniscus, and any
The
bone spurs that
rongeur.
may be blocking the bone.
Oh yeah, it like clips stuff off.
Are you a good
Oh,
sculptor?
yeah,
It's
okay.
time to shape the femur, tibia,
femur, the
and
tibia,
patella,
and the
so
patella.
the new knee components
My
fit
favorite's
properly.
the patella
A
because it's
hole
so
must be
small
drilled
and it looks
inside
like
the
a little
femur to set up the
thing.
distal femoral cutting jig and alignment device.
My God!
Inside the femur to set up the distal femoral cutting jig and alignment device.
Oh God!
The jig is
I
put
just
into
keep getting this
position and helps
weird
ensure that the
feeling
cuts
when that
made to the bone
happens.
are exactly what are needed. Now hammer in the pins to hold the jig.
Get the mallet from the toolbar. Bar.
And helps ensure
Oh
that the cuts
God!
made to the bone are exactly what are needed. Now,
Just imagine doing that and just like watching.
we can
the
now
entire
remove
thing.
the alignment device.
Like
The
your
pins
leg
will hold the
getting
jig
cut
firmly in
open,
place.
and
Now
then
for some real bone shape.
nails being
Use
put
the bone
into
saw
your,
to cut the bone so it
the
is
bone of your
prepared for the
leg.
new femoral component. Hold the jig firmly in place. Now for some real bone shape. Use the bone saw to cut the bone so it is prepared for the new femoral component.
Oh God! I mean, that's actually not that bad. That wouldn't seem
Another
that
cutting
bad.
jig, along with the
Ooh,
bone
looks
saw,
cool.
allows us to finish shaping the femur.
I don't know. Oh, they cut the top off.
Let's move on and shape the tibia. The tibial cutting jig is aligned with the big toe and the
God, it
highest
hurt
point
like
of the
heck,
tibia.
though.
This will ensure the leg is properly aligned after surgery.
If you had
Secure the jig in
freaking
place with more
leg
pins.
bone that was shaped like that, though. And you watch the entire thing. Mallet.
Secure the jig in place with more pins.
Yeah.
Use the bone saw to cut off the top
Okay,
of the
grab the
tibia
bone
and
saw
prepare it for the
again.
new tibial components.
Okay. Cool.
Use the bone saw to cut off the top of the tibia. Now we'll use the patellar cutting jig
Grab the
and bone saw
patellar
to remove the
jig.
back of our patient's patella.
The patellar jig. Oh, they're not gonna take it
Now we'll
out,
use
are
the
they?
patellar cutting jig and bone saw to remove the back.
Oh, they are. Oh, no, they're not.
Holes
took
in the
half
tibia
of
and
it out.
patella are drilled and chiseled out, which will enable the new components to attach properly. Time to place the trial
Ew,
components.
not a close-up.
Attach the
That's
femoral trial
disgusting,
component.
because you can see, like, all the stuff around, and it's really gross.
Time to place the trial components. First, attach the metal tray trial component to the tibia.
Jordan? What are you watching?
Metal tray trial component to the tibia.
Oh, okay, that makes sense. Oh, yay. I've always loved the plastic
Lastly,
spacer. I don't
attach the
know why.
patellar trial component.
And I've loved the cement, because it's green and it's really weird.
Typically, a normal range of motion allows the leg to move from 0 to 130 degrees. How does our patient's range of motion look?
Just jiggle your leg
Knees aren't
around
meant
a
to
bit.
bend sideways. So
Oh,
it's
whoops,
important to
accidentally cut it
determine whether
open.
there is a gap or space between the
Ew,
femoral and
ew,
tibial
ew.
components.
Yay,
Mix
cement.
up a batch of cement for you to use. With the cement in place, the final components are permanently attached to the knee.
Cement
Any
in your
excess
leg,
cement
man,
will be
that's
scraped
just
off
so
and thrown away.
interesting.
Lay the leg
See, because you can, and it leaves stuff in the end, like great parents.
suture deep tissue and fat layers back together.
In the new ones, it actually shows the
For
thing
closing the
going
surface
under
incision,
the
you have a choice
skin.
between the stapler
I'm gonna
and
be
the
doing
suture.
more of these. I want to do the stapler because I haven't used it.
What is the primary difference between these two methods of closing the incision? Excellent.
Longest one.
You
Okay,
know,
that's
we
good.
couldn't ask for a better participant. You've done an excellent job. Are you sure this is your first total knee
Sure, this
replacement?
is a total knee.
Our patient will remain in the hospital for 3
Because
days,
there are more of
followed by
them,
3 to
and I'll
8
be
weeks of physical
doing
therapy.
more.
Because of this surgery, our patient will have significantly reduced pain and increased mobility.
Oh, okay. Otherwise, thank you guys for watching this video. I hope you enjoyed. Leave any comments I should do to make my videos better. Like if you enjoyed. And I will see all you peeps in the next video.